Hi guys. So a lot of people, ask me very frequently if they should take up opthal, if they should, put their money in radiology at all. Is AI going to take over radiology? So there will be a lot of questions before you choose your branch. That's for life. Okay. The college you're going to is going to be there only for 3 years. The branch is going to stay with you for your life. So you need to choose it very wisely. And I'm not, and nobody is probably to take the right decision for you in that matter. You need to think it out yourself. But I will help you in choosing the right specialization for you. There are a few steps that I followed, and I've made a list of those steps that you need to follow in terms of, finalizing your branch, selecting it properly, and sticking to it. We will analyze everything about that particular branch in subsequent videos and then choose the perfect specialization for each of us. First thing is, what are your interests and what is your passion, right? So how do we do that? How do we choose that? What did you enjoy most during your MBBS? Was it the late night duties in emergency? Was it the odd hours of OBGYOT? Was it the fixed working hours of a psychiatry OPD? Was it operating on very high risk cases in neurosurgery? Which lifestyle did you like the most? What piqued your interest the most? Was it some amount of microsurgery, as in ophthal, as in ENT, right? So these questions you need to ask yourself. So I prepared a list of questions and a list of things that you need to keep in mind. We'll go on analyzing, we go on writing it down, and then we will eventually conclude and select our specialization. So which branch can you do for the rest of your life? Do you, enjoy being around kids? Some people do. But when you go to NICUs, when there are a lot of sick small babies, 15-day into their, journey on earth, and they are lying sick, helpless, their parents are feeling helpless, would you be able to cope with that? There is a lot of, risk of fatality in pediatric branches. And if you try to open up your own setup, if you try to open your own ICU, pediatric ICU or a neonatal ICU, the rewards are very high, but the risk is very high. You can't leave that place for a long time. So you need to, think about that as well. Do you like fine work? Do you like rough work? Do you like, the power, the muscle, the build that's required to do orthopedics? Or do you like, the microsurgery of ophthal? What kind of work-life balance do you like? Do you want to enjoy a perfect lifestyle? Or you are just too committed to the profession and you want to operate at all times? Do you like the hectic life of an orthopedic surgeon or a OBGYN? No fixed working hours? Or do you like the OPD hours and the elective OTs of ophthal, of ENT maybe? Or maybe psych also? You need to choose that. You need to know what is more important for you. So we'll dive deeper into these topics and we'll try to answer these questions by ourselves, by asking ourselves what we enjoy, and we'll finally land up with a dream branch. We'll also see what kind of cutoffs will be there for each branch, and we'll finalize according to how much, if at all, we want to pay. Is worth it? Is the ROI there? And we'll dive into deeper discussions on the same. All the very best till that time. Subscribe to the channel, join the WhatsApp group, and ask me if you have any more doubts. Thank you guys. All the very best.